All right, ladies, grab your husbands and bring them into the room right now for this next segment. You know, as women, learning about our bodies and how much our hormones, or lack of them, play an important role in our overall health has been the focus of many segments. But quite frankly, we could never learn too much about that. But today, we're going to focus on our men. Did you know they go through the same thing? Dr. Gino Tutera, founder of Sotopelli Therapy, is here with us to explain what men experience, along with one of his patients, Chad, who's been so kind to join us. Welcome to both of you. All right, so Dr. Tutera, we as women go through menopause, but you say men go through the same thing?
Right, and we term it andropause because the first portion of that word, andro, refers to the type of hormone that men typically produce, which is testosterone. That's an androgen. So it's andropause because it's related to the failure to be able to produce enough testosterone. And what happens is that as we get older, our production goes down and we start suffering with a significant number of symptoms.
Okay, let's talk about those symptoms. Some symptoms that men might be experiencing if they think that they have andropause or going through andropause. If we could put those up on the screen for us, because I want you to kind of point those out for us a little bit, Dr. Tutera. Andropause symptoms.
Well, first of all, you get that decreased energy and it becomes very low, and as you age, you know, that impacts your libido. And you start, wondering what's happening to me. My stomach is starting to enlarge. I'm depositing fat over that, that spare tire that we get. Mm-hmm. The muscle mass decreases because there is not enough testosterone to actively help the muscle to grow and to be as functionally, physiologically normal as it should be. And then, unbelievable that how much fog you get and how forgetful you become. And you become depressed. You become irritable because the brain can't make, serotonin, and all of these combined all of a sudden make you think, well, I'm just, think I'll just sit on the couch for the rest of my life and not have the energy and the sex drive that, that I once had.
So, Chad, does this sound familiar to you at all, any of these symptoms?
Very familiar. What would happen to me is I would short circuit and not remember things, and I would not have as much energy as I used to in my earlier days, my 20s, and it was kind of upsetting. And now I can keep up, and I can go hike with the family, and I can exercise whenever I feel like it, and I can be active again.
So did you decide that you needed to do something about it, or did your wife say something, or your girlfriend, or your neighbor, or your mother? I mean, what happened?
A friend said something, and I said, I'm going to do something about it and see if it helps.
Good for you. Good for you, Chad. And this is exactly what he did. I'm going to pour these little tiny pellets here, because this is what we're talking about. We're talking about the Sotopelli therapy treatment that Dr. Tutera has talked to us about. Let me see if you can see this here. This is what you did. I can't get the other one out, but this is what you did, Dr. Tutera, for Chad. And what exactly is this?
That's basically pure hormone. And it's we place it just directly underneath the skin. And the pellets are of different sizes. The male pellets are a little bit larger than female pellets, and and what happens is that as the body utilizes this in a way that, if you would think of it, a child licking a lollipop. So as the pellets are placed, then as the heart pumps blood across these pellets, it allows the body to basically release hormone on a as needed basis, but make it a continuous release, which makes it different from every other form of therapy, because all the other forms, it's just sporadic peak and valley sort of thing. You put a cream on, it lasts for a couple of hours, whereas with the pellets, they're there 24 hours a day for forever.
And if you could pop up that final graphic for me, because I want everybody to see that the difference is just the absolute opposite of what happened. Increased energy, increased sex drive, weight loss instead of weight gain, increased muscle mass, mental clarity, and increased sense of well-being. And Chad, do you have those things now?
Yes, very much so. It makes it very nice to fit in clothes and be active again, and my wife to be happy also.
And to be thinking clearly. I love it. Thank you so much, Chad, for coming on and sharing your story. We really appreciate that. And Dr. Tutera, as always, this is a brilliant invention here that we all love, both men and women. Okay, here is some information now. There's going to be an opportunity for you to learn more about Dr. Tutera and the hormone replacement therapy for men and women. There's a free seminar. It's February 7th. It's going to be at the Melting Pot in Scottsdale. Everyone who shows up will receive a $30 discount card, and you do need to RSVP. Space is limited. And as I said, it's for both men and women. So learn more about your hormones. Here's the information to Dr. Tutera's office, and you can find him at, it's coming up, I know it is. There we go, 480-874-1515. That's an easy one to remember. Also a website, sotopellytherapy.com. You can take a self-test on the website and see if you are suffering from hormone imbalance. Again, Dr. Tutera and Chad, thank you so much.